A shocking new investigation by the Hearst Corporation says an estimated 200,000 Americans will die this year from preventable medical errors and hospital infections. The report also says 20 states currently have no medical error reporting systems in place. Here with some tips on how you can protect your family from medical errors is our own Dr. Jennifer Ashton. Jen, good morning.
Good morning, Debbie.
This does not make you feel good about getting sick, no pun intended.
Absolutely not.
What are some of the causes of these deaths?
Well, you know, there's a long list, Debbie, and it could be everything from sleep deprivation of the medical staff to poor communication to illegible handwriting to an improper nurse-to-patient ratio. The list keeps going on and on and on. The bottom line is this kills more people each year than car accidents, and out of every 15 hospital visits, one child is injured due to medical errors. So this is a significant issue.
I got to say, it's shocking. But the important thing is then, what should we do to protect ourselves and protect our family?
And obviously, we don't always have a choice when we have to go into the hospital, either ourselves or loved ones. The first thing is people should remind all medical personnel, if they're having a procedure, where that procedure is being done, what side it's being done on. Wrong site, wrong side surgery is a real issue. So if you're having surgery on your right knee, expect about 10 people to ask you, and the surgeon should actually sign with ink on your right knee so they know where the surgery is occurring.
And you should keep saying it over and over. It's my right side.
Absolutely. The second thing, it has to do with medication error. This is the most common type of medical error that occurs in the hospital, and this is huge. So when you're given a medication, you want to ask what the medication is, remind the staff of any allergies, and be aware of medications that sound like other ones.
Okay. And then also in the OR.
Absolutely. The third one is can be a little bit logistically difficult. You really want to see your surgeon eyeball to eyeball while you're awake, not sedated, before you go into the operating room for surgery. The surgeon is really the captain of the ship when you get into the operating room, and he or she is responsible for making sure that a lot of these errors don't occur. So don't be brought into the operating room unless you've seen your surgeon in front of you.
And I imagine this is something you need to talk to your surgeon about in advance, because some surgeons routinely go in.
That's absolutely correct, and it's a logistical issue. Sometimes they wait till their patient's sedated, because that could be 30 minutes after the patient is brought into the operating room, and sometimes they have other patients to see. Ask about that before you get into the hospital.
In just seconds, Jen. So for those who are afraid by what we've just heard, what's your recommendation?
Communication, awareness, and knowledge is the key, Debbie. Sometimes we don't have a choice when we go into the hospital, so taking these steps can minimize those errors.
All right, Dr. Jennifer Ashton, thank you so much.